Hi everyone, welcome back. This is the second part of what we discussed recently, my journey to become a doctor in Australia. So let's get on to the second part of my journey. You remember from the last time, I was talking about how I did the AMC part 1 and part 2, and then what sort of things I had to do before and get through the part 2 exam. Now, today, I'm going to discuss from part 2, so the successful completion of AMC part 2, to getting a job in a hospital in Australia. Okay, let's get on to the story. Okay, it's a nice story. So, remember, I did the AMC part 2 in Sydney Children's Hospital, and then I got through successfully. And then I gave you some examples of the cases I had to do and things. So I got through the part 2. And then I thought, yeah, okay, I'm now eligible to get the job at a hospital in Australia. Then I prepared my CV again with the part 2 exam results, English and AMC part 1 and all of my other qualifications. And then I wrote a cover letter. For the guys who haven't seen it, I have told them how to write your cover letter and then how to how to prepare your CV according to the upper format. That's there in my other channel. So then I prepared for application of jobs, which is the next part of your journey. Once you clear AMC exams, the next part is to find a job. So today, what I'm going to discuss is how to find a job and how I found my job, which is interesting journey because I had to do a lot of things to come to that level. So got the exam results, arrange my CV and prepare my cover letter, and then I applied. I applied in different ways because still I'm living in a country town in Bendigo, not far from Melbourne. So I just targeted the Bendigo base hospital first thing, which has some connections already. As you can remember, I used to go to case discussion in that hospital. Case discussion group in that hospital. So I targeted the Bendigo base hospital, as well as other hospitals close by, hospitals in Melbourne, and then South Australia, Western Australia, New South Wales, everywhere actually, even in Tasmania. So what I did was like applying directly to the hospitals, applying through the RMO campaign, mainly the PMCV match in Victoria, which is the RMO campaign for Victoria. I have done another video about this, how to go through this campaign. And then I applied directly to other hospitals. From my memory, I have applied for Shepparton Hospital, Swan Hill Hospital, Echuca Hospital, Frankston Hospital, Western Group of Hospitals, Monash Health, almost all of Ballarat Hospital, almost all the hospitals in Victoria, plus the RMO campaign, mainly the Victorian RMO campaign, because I was targeting the places close to my home too. So I kept active on all those areas, direct application plus direct applications to hospital through the HMO units. And then I applied through the RMO campaign too. And then I was waiting. Didn't get some hospitals answered, some, not many hospitals give me any interview even. I didn't get any interview from any hospital like Frankston or Western or any other hospitals. And even Bendigo, I didn't get any interview at the first place. Then RMO campaign, I was waiting on the same thing as well. So I got different numbers for different applications and things. And although I was trying that way, I was also active with the other group of people, other group of international medical graduates who actually studied with us in Monash under Dr. Johannes Wenzel's class. So we were sort of talking to each other and then would discuss other options. How do you go about finding a job and things? Somehow, a lot of people said to me, okay, you better do observership if it's possible. If you do observership while working as a lecturer in the same area in Bendigo, the best option would be to try observership in the local hospital, Bendigo Hospital, which I knew a little bit, like because I used to go to the hospital. So then I asked for observership, writing to the HMO unit, maybe writing to ED director as well, from my memory. But it was not forthcoming, so no one offered a observership. Bit frustrating, isn't it? You have completed your exams, you got your English qualifications, you have done your bridging course, you are almost there with the qualifications they request and request from you, but still the job is not coming. Then I was talking to different people, including my brother who's in Melbourne, and he's again a doctor in Australia. So I said to him, okay, I got through the exams, but still this is not possible. I may need a observership. Finally, so he gave me a link. That link is not directly to the ED director of Bendigo Hospital, but one of the rehab physicians working in Bendigo Hospital. And the rehab physician then spoke to me while I was in the uni. And then he asked, Kirti, what do you want to do? What's your plans? And then I remember I said, because I'm in the uni, I like to get my full registration with with APRA for the clinical registration, and I'm thinking about doing research as well because my brother told me like that. Okay, talk about research with this guy, and then he said, "Oh yeah, for research it would be better your brother if he collaborate because you are a bit of a junior guy still in the system. Anyway, what do you require?" I said, "At least." Observership to start with. Then he actually negotiated with the then ED director, a lady, and I got the observership offer. This was in 2013. Not immediately, after it's like 6 months or so after my part 2 results, AMC part 2 results. So I did the observership. Initially, they offered it for 1 month. They said, okay, this is a 1 month observership. There was a guide to say, like, there was a kind of a handbook for the observer to fill, like this many cannulation, I have observed this and I have done this and that sort of thing to sort of tick and fill, like there was a book. It was not a necessity that time, but it has been there for a while at the emergency department Bendigo. So I got a copy and then I decided, okay, I'll work according to this booklet so that I will cover what they supposed us to cover as observers. So I went in there and then I was introduced to the ED doctors. Director herself and then the other doctors on the floor. I got to know 2 of the senior ED doctors. They were like deputy directors, I think one clinical, one academic or something. Those 2 guys I get to know. I don't like to mention their name. One of them is still my friend, LinkedIn contact, and we time to time message to each other and things like that. Something else I have to mention here, those two guys actually are like similar age like myself and around same age, but they are like fellowship holders for emergency medicine, and then quite senior guys. One of them now a director in like the one I have close links with is now the director in a leading hospital in Melbourne, emergency department. And so I got to know those two guys, and then they were sort of observing what I'm doing. And then the guy I was having close links with was the guy actually leading me to do a few different things. He would say, Kirti, there's cannula, like a catheterization happening. Do you want to do the catheter yourself or you want to observe? And then I remember I said to him, okay, maybe this is the first time because I will observe this time. Next time I'll do it myself. And so then I was observing local graduates, like an intern, doing the catheterization of an emergency patient. It was interesting because that's why we have to do the observership, because with the facilities you have back home, and then the way you do things and the facilities you have here, and the sterility, the way they do the procedure, and things like that. It was perfectly done by the intern. He's a good friend of mine now. He's a GP around here somewhere, and it was perfectly done. He was a graduate from Deakin University in Victoria, medical graduate, and so he did the catheterization. So I just observed, and then I make a note to say, okay, I observed the process of catheterization. And the cannulation, of course, I got, like, I think you guys understand from my sort of way of doing things and what I'm talking about and things like that. I'm a very friendly character, so I'll get friendly with a lot of people quickly, like networking. And so I got friendly with all the other HMOs, like international graduates in the emergency department. So I would follow one or two. I remember there was a lady HMO. I was saying to her, okay, I will just observe you today. Then I will following her, and then she would ask, oh, Kirti, you want to do this cannulation? There's a cannulation to be done. So then I did, for my observership period, I probably did more than 5 cannulation, 5 to 10 maybe, according to the person, whoever I'm following. So I did few of them. So I just got used to cannulation at the emergency department while I was observing. The other doctor would introduce me to the patient to say, okay, this is another doctor training in the emergency department at the moment. Is that okay if you do the cannulation under my supervision? So that sort of thing. So I did few of those smaller procedures, right? And then observing a plaster being done. And so ticked all this to say, okay, I have observed this, observed that. And then one day, the director lady said to me, okay, Kirti, you are seeing this patient under me. So she said, okay, go and see that patient and make a plan. And then, so I did history examination. I think it was hyperemesis gravidarum, like vomiting during the pregnancy, early pregnancy. So in that case, I said, okay, these are the findings. This would be the blood test I would be doing, and then IV fluid, and checking liver functions and things like that. And so she said, like we had a discussion about presentation to her, presented the case to her, and discussed the management plans and things like that. After a few days, she said, so you were booked to do the observership for 1 month. I don't think you had to do 1 month now, maybe do 2 weeks, and then that's it. So I stopped at 2 weeks of observership, and okay, back to the lecturing work again, and then kept applying for hospital jobs again. I was mainly concentrating on Bendigo base that time because I have done an observership there as well. So the CV of mine got that bit too. Okay, observership at Bendigo Health from this date to this date. And then, so that's the CV updated. I don't know whether I mentioned to you guys with the other video, I also did a bit of observership with a local GP in a local GP clinic, not far from here, about 2 kilometers from here, next to the university, close to the university too. So just walking distance to university and bit of a far away, but still walking distance to my home. So I did time to time go and observe that senior GP. He's now retired. He's in Melbourne. And so he's an Indian general practitioner. So who offered me to have observership with him too. So I put that to my CV. So I observed Dr. So-and-so at his clinic, and then I observed I did the observership at the emergency department for 2 weeks. With that, like the HMO application comes twice a year, one in February and then the other one in July. So I kept applying for the HMO jobs in Bendigo Health, plus other places as well. So after there's one more thing about the observership in Bendigo Health. While I was doing the observership, I realized there was a weekly teaching session for the registrars. That's a registrar teaching session. It's called the M&M meeting, or morbidity and mortality meeting, but one of the registrars would be taking the presentation, and then one of the fellowship holder emergency physicians will be there as a guide, and then all the other junior doctors, including HMOs, registrars, medical students, interns, everyone would attend the session. And then generally one of the senior clinicians, say a surgeon or a ICU consultant or pediatrician or someone would present for 1 hour or so, but this teaching session run generally from 8 o'clock up to 11, 12. The doctors keep coming and going depending on who need to be in the floor. Some need to be working at the emergency department. The others would come to the class. The guys who are not rostered, or some of the rostered guys, would also come. So for those 2 weeks, I attended that class. And then I told my, a close consultant, I would like to attend this class, even though I'm not observing, if you don't mind. Then he said, okay, you can come to that class, but no one else. That means he said, okay, you come in, but don't bring anyone else, the other international graduates who living in Bendigo, don't bring them, but you can come in. They probably knew that there's others who are knocking at the door and others who are practicing, trying to get jobs. There were a few, at least I knew 4 of them, 2 Sri Lankans and 2 other countries. So there were a few around in Bendigo, looking for jobs and looking for observerships and things like that. Anyway, I got the offer, like he said, okay, join our class if you wish, which is every Wednesday from 8 to 12. So I attended the 2 sessions while I was observer at the emergency department. After that, I got the permission from one of the education director of the emergency department to say, okay, Kirti can come as a voluntary guy. He can come every week. So from that time, I think it's early, sometimes early, say April, May, somewhere, from 2013. Every week, I attended that class. Every week from Wednesday, 8 o'clock to 12 o'clock. I went in there voluntarily, and I should give my credit to the supervisor or the professor who was heading our department in La Trobe Uni, because he said, yeah, you can take that time off, do your studies, do your teaching in the afternoon, and then use that time. So that was very kind of him for me to allow to do that. So I just got time off to do that class. So every week I was attending the emergency department teaching, which is like I was not an emergency doctor there, but I only did observership for 2 weeks. And then I was attending every week. You remember the guy I was doing the catheter observation with? So the intern, he was also attending whenever possible. So I got a lot of friends after that. I made a lot of friends who are doctors working in Bendigo Health. Because every week you will be there and then you'll find doctors there. Some would be presenting, like a pediatric surgeon would be presenting, or the ICU consultant would be presenting. And then you guys know that I got an anatomy background. So when the discussion happening there in the teaching session, they put up a CT, for instance, CT of a brain, and then they would say, what's this mark and what do you think about it? What are the differential diagnoses? Then I would sort of score some marks in front of the others because I could interpret a CT, like I would say, this is subdural, this is epidural, midline shift. There are some fluid, like those terms. There are some fluid at the subarachnoid space. Can you see that? And can you see that? And so kind of active discussion. Although, although I was not working there, it's interesting because some of the registrars would come to me, sitting next to me, would say, "Hey, Kirti, what are you doing?" Like I get paid to attend to this because he's paid. He get those 4 hours paid for him, like an hourly rate. But for myself, it's free because I'm not getting paid, but I'm learning or I'm networking. I'm joining with them. So I would score some marks. For instance, when the ped surgeon came and presented about torsion of testis was the topic. And then I had an experience about hearing something happened in Sri Lanka to someone close to us, suspecting torsion of testes, and then going to the surgeon, going to the physician, and reading about the clinical features and red flags and everything, and then age brackets and things like that. So I just started discussion. When she asked questions, I answered. So more than the normal registrars, I got the answers right. So got a bit of attention there as well. I think you guys following what I'm trying to say to you. You should be kind of active, and you should be showing some interest, and you should be like showing the people that you are tapping at that door. So that was a very interesting time. I was attending this class every week. Every week you would be involving with all those discussions, good discussions, learning points, near misses. Everything happened in the emergency department. It was a very good resource for me to sort of brush up my clinical knowledge as well. At the same time, those guys, those consultants who were running the class probably got to know the guy who's coming as an observer and then now doing these classes, attending these classes every day, not missing anything, every week. So every week I'll be attending every Wednesday. So I did this for almost an year and then kept applying. And then I got the return from the HMO unit to say, okay, Kirti, you are not successful this time, not successful this time. It happened a few times. Whenever a HMO job available in Bendigo Health, I'll apply and then I'll get the same response. So I applied for the one in 2014 February 1, and then I got an interview for the first time. So I attended the interview at the Bendigo Health interview room, and then the consultant, there was a consultant, I think gynecologist, a lady, and then who was interviewing me said, Kirti, you got all this background with you, but you haven't touched a patient. It would be hard for you to come into the clinical setting straight away. And then I said, what should I do? I have done these exams and I have done all these. And then that's the time I think she probably told me, okay, you better do an observership too. I don't know how you go about, but try something. And then I was rejected at that time. I think it was not 2014, that was 2013, July 1, like the intake. So I was not successful. And then from the 2014 one, I applied. I didn't get an interview, but I got a rejection notice to say, okay, you are not successful this time. I think this is what is interesting, and these are the things that would motivate you guys. When I got the interview, when I got the email, I just replied to the email saying, okay, I understand that I have not fulfilled the criteria for your position, but I would like to get some more clarification why I was not suitable for this position. Please clarify. And then I said, okay, I have completed these things. I have done part 1, part 2, bridging course, observership, and then attending these classes for almost an year. And tell me why I'm not suitable. That's went to the HMO unit, replied to the HMO unit email. And I was waiting in the lecturer's office in La Trobe Uni, and then wondering like, okay, I was rejected this time too. Now, nothing more I can do. I have done all those things. Now it's doing some rotation in a hospital. Then I took the phone and then rang the director at the Bendigo Health. Just dial his number and rang. And then from the other end, the director picked the phone and say, okay, I told, I'm Kirti from La Trobe Uni, and I applied for my HMO job recently and I got rejected. Then he said, Kirti, I was about to reply to your email. I got your email about needing clarifications. I'm about to reply to your email, he said. Then I said, don't worry, I'm not far from your place. It's only 5 minutes from here. I will drive in and then we'll talk. Okay, so I told the director like that. He was appointed the director of hospital just recent to that time, like few months earlier. I'm not sure whether he's around still. I think he would be doing another role now. And then I met him personally. I just said, 5 minutes drive, I'm free now, I can drive in. So I just took the car from the university and then drove to the Bendigo Health, which is only 5 minutes drive. And then I met the director at his room. Took a copy of my CV and went to meet him. And then he said, yeah, come in, Kirti. I saw your email and then nice to see you and come and sit. And then I said to him, I don't understand why it was rejected. See my CV here. Tell me if there's anything need to be done to this CV, or is there anything needed to upgrade? Because it got all the information about me. I'm not understanding why this my application get rejected. And then he said, first, at the first instance, he was not interested much. Oh, yeah, there's a HMO job. It was rejected. So what's the big deal? And then I said, okay, I told him, I don't like to mention their names, but I told him, okay, Dr. So-and-so, please have a look at my CV and tell me any improvement needed or anything. So I just forced him to have a look at my CV. But at the same time, I kept talking. And then I said, you know, Dr. So-and-so, I have seen your LinkedIn profile. And then I said to him, okay, looking at your LinkedIn profile, it's very, very similar to mine. I said to him, okay, we have had a similar journey because he's a doctor from another country. I think he's from New Zealand, and then moved here, and then he had a bit of a research background, and then he's had clinical background. Now he's the director at the hospital Bendigo Health. So I think that interested him a bit more. So he went into my CV and just had a look and said, "Oh, it's interesting. You have done many things, man." So something like that. And then he said, "What are you expecting from us?" I said, I need to get the full registration. To get the full registration, I at least need 12 months of rotations. In theory, 1 year of clinical rotations, like emergency, know all this. So I said, I need at least 1 year of clinical rotation. He said, okay, we'll think about it. I'll try to help you to do those 1 year of rotations. And then I said, okay. While, sorry, I keep coming back and forth because when I tried to sell myself to this guy, I just told some other things. I said, do you know, I used to come to this once a week clinical sessions at the emergency department, and then the classes at the same level of your office at level 5. That class is run by the GP for IMGs, and then which I mentioned last video. And then I mentioned about this emergency department classes. Every Wednesday I'll come to these classes, and then I told him, okay, I used to come to those two things, and then the people around here will just greet me here and there at the lift or at the stairs, the staircases, and then say they would ask. It's usual question actually. They would ask, "Kirti, have you got a job this time, man?" So they will ask, like other HMOs, other interns, and or even registrars or consultants. They would ask, "Have you got a job this time?" So I just mentioned to him, like I am here. I have been here for now almost 2 years or something, 2 3 years. I was keep attending classes, keep coming for like different places in the hospital, but I am still not working here. It's bizarre, isn't it? You will be in the hospital most of the time, yeah, but you're not working. And then when you go out to the staircase or when you go on a lift or something, they would ask, Kirti, have you started working here? So I told him, okay, that's the typical question I get when I go out from your room, which is true. And then, in fact, when I will tell you a bit later, then he said, okay, we will organize something, make sure like I will make sure that it will happen. So I was happy, and then I came back. Then the day after, I went to the usual emergency department classes. You remember the director I was talking about, the education director? That guy then asked, I was sitting at the class. Then he said, good morning, Kirti, how are you? Have you got a job this time? He asked, have you got a job this time? I said, no. I was with the director yesterday, like clarifying, wanting the clarification to say why it was rejected this time too. He said, oh, no, I'll talk to the HMO unit. So there was a push from the director, and then there was some sort of backing from the emergency department education director. Both of them I had good discussions time to time. And the director, hospital director only once, but the other guy I would meet every week. So the next day, I got an email to say, okay, Dr. Kulasekara, you got an interview with the hospital director and the HMO unit manager on this day, around this time, and please attend the interview. Okay, so I met the hospital director requesting the clarification for the rejection of the application. And then I went to the usual class and met the ED director. And then a few days later, I got the interview. And then at the interview, there was the hospital director one side and then the HMO unit manager. Hospital director said, oh, yeah, I have spoken to you 2 days ago. I don't have any more questions. I got all the clarifications. Have you got anything? He asked from the HMO unit manager. She said she asked some, questions about non-medical things, administrative and otherwise. And that's it. And then they said, okay, come and do rotations and emergency department. Okay, that's the second part of my journey. So this is when I started the emergency department HMO. I just started as a HMO in emergency department. I think they put me with the registrar for 7 nights or something at the beginning. They didn't do any other observership or anything with me because I already did the observership and already in their classes. And then they just offered the HMO job. And then I just joined the ED. Just before I finish, that's the completion of the second part of this talk. Just before I finish, remember I told you that I told the director if I go out, someone would ask whether I would be working. So I came out from his room and then came to the lift at the level 5 of the building. Then at the lift was that guy, you remember the one who was doing the catheterization, the intern who was doing the catheterization with me. When I was an observer, he asked Kirti, have you got a job this time? So that's the typical question I got. And then the day after, I actually got the job. Okay, that's the second part of my story. Hope you guys enjoy it.